My name is Yvonne Langan and I'm a consultant clinical neurophysiologist in St James's Hospital in Dublin, and a large part of my job involves looking after people with epilepsy and communicating with their families, and also interpreting some of their investigations such as EEGs and brainwave tests. We know that people with epilepsy have a mortality rate 2 to 3 times that of the general population. Now, sometimes that can be due to the underlying condition, a stroke or brain tumour, but the commonest type of seizure-related death is sudden unexpected death in epilepsy, or SUDEP. Often these individuals die at night and are found dead in the bed, and there's often evidence that they've had a recent seizure, such as a bitten tongue or disrupted bedclothes. We don't know the cause, and at post-mortem examination no cause is found for death. I've been involved with a number of projects looking at SUDEP over the years. My most recent work here in St James's involves supervising Dr. Yvonne Langan, who has looked at the relationship between heart rate and blood pressure in individuals with epilepsy and compared it to the normal population. We have found that in people with certain types of epilepsy, this relationship may be abnormal, and that this may make them more at risk of abnormal heartbeats. We looked at individuals with different types of epilepsies, and we found that in those with temporal lobe epilepsy, the baroreflex sensitivity was reduced, and that would suggest an abnormal relationship between heart rate and blood pressure in those individuals, which might predispose to abnormal heart rhythms. This is a useful finding because it adds to the body of knowledge on potential mechanism or mechanisms for SUDEP. It may help us in the future to identify individuals at particular risk of SUDEP, and it may lead on to future research projects. During the course of the baroreflex sensitivity study, we became aware that the level of knowledge among those with epilepsy with regard to SUDEP is quite poor, and I think this is probably mirrored in the general medical population as well, who always seem quite surprised when we discuss the topic of SUDEP. From the point of view of reducing risk, I think the most important thing, and we know this from a variety of studies, is to achieve the best control possible for an individual patient. We know that one of the strongest risk factors for sudden unexpected death in epilepsy is poorly controlled generalised tonic-clonic seizures. Any support that's forthcoming from the general public, either financial or otherwise, is very much appreciated, and we are indebted to Epilepsy Ireland and patients' families for their support in our own work.